Despite all the hopes of the aggressor country leaders, Ukrainian society did not fall into despair. On the contrary, the citizens of Ukraine united for the sake of a common victory.
Civil society and community is also backbone of the HIV and TB response.
As of today, more than 1,000 Ukrainian hospitals have been damaged or destroyed. Russia ruined more than 40% of the energy infrastructure in Ukraine, so now Ukraine experiences a significant power shortage. More than 70% of Ukrainian citizens are in stress. Residential buildings are under enemy fire every day. Even some members of the alliance team lost their homes as a result of Russian barbarism. Since February 24th, Alliance for Public Health has completely restructured its work in accordance with wartime conditions. We knew that in the highly volatile environment of war, we cannot be static. That's why we took the following plan as a basis. Services must be mobile and accessible, integrated into the online environment, and meet the specific requests of the client. In the new work format for 2022, we managed to detect 54% of new HIV cases in Ukraine. We attracted almost 80% of new PrEP programs participants. We transported 1.2 million kilograms of crucial humanitarian goods to more than 100 medical facilities in Ukraine. We provided mobile medical services to more than 90,000 people and targeted humanitarian aid to more than 52,000 Ukrainians. Today we coordinate 13,000 migrants in 35 countries of the world.
If someone asks to me for food and bread, I cannot say, sorry, I have just condom for you. Yeah, we have to be relevant, and we shouldn't say no in the context of war and humanitarian crisis.
One of our first solutions was the coordination chatbot Help Now, which was launched on March 1st to quickly help Ukrainian patients in Ukraine and abroad. We have made the service as accessible as possible. The client can apply anonymously through the chatbot and receive a response within an hour. Subsequently, the services of the hub were expanded in response to current needs. Thanks to the support of governmental and non-governmental organizations, we have provided treatment and support to our clients in 35 countries of the world. The Help Now hub has already provided assistance to more than 13,000 Ukrainians abroad. A new direction of our activity is humanitarian convoys. In 9 months, our vans covered more than 1 million kilometers and delivered more than 1.2 million kilograms of important humanitarian cargo to more than 100 medical and social institutions in the country. With the same minibuses, we evacuated people from the war zone. To restore the infrastructure and provide the internally displaced persons with minimum living conditions, since June, the Alliance for Public Health conducted an all-Ukrainian targeted humanitarian program. In the framework of the new humanitarian project founded by Christian Aid, we funded 77 applications from different action groups to solve actual problems. The main support included creation of heating points, purchasing of heating devices, installation of premises, assistance to IDPs, children, people in difficult life circumstances, and from risk groups. In total, we supported more than 52,000 people. After the liberation of the occupied territories, it turned out that the most of the hospitals were destroyed, so it's impossible to quickly restore their work. And the large number of internally displaced people created an additional burden on the surviving medical infrastructure. Therefore, the Alliance for Public Health improved the operation of the network of mobile clinics and expanded the range of services. But the most important thing is that you can take a test in a mobile dispensary and, depending on its result, start treatment on the same day. With our 40 mobile dispensaries, we served more than 90,000 clients. Since the beginning of the war, the number of patients with symptoms of acute stress disorder, anxiety and depression has increased significantly. The Alliance for Public Health has launched a new mental health project aimed at improving treatment outcomes for patients from key population groups. Help24.org website became the platform for this service. People with symptoms of depression can receive psychological help and pharmacological treatment with antidepressants there. During the summer, our specialists conducted more than 1,000 consultations among our clients. For almost 9 months, we all live in the emotional swing mode. However, constant emotional upheavals have a negative impact and physiological state. The social workers and professionals on our team are people too, and they can feel the effects of stress neither. For this purpose, we created the project Supervision, psychological support for professional. During 9 months, 662 supervisions were conducted at the project site, in which 141 specialists took part, and almost every social worker or doctor underwent more than 2 supervisions. The main conclusion for this story is quite simple. No matter what weapon Russia will use, it will lose anyway. Russia can ruin our infrastructure or destroy our homes, but missiles and tanks cannot destroy human values. Let's win together.